The new coronavirus, or COVID-19, has spread far across Asia, reaching the continent of Europe, where nearly 400 cases have been confirmed. Austria, Croatia, and Switzerland have confirmed their first cases on Tuesday. Germany and France have both seen over a dozen people infected. Italy has become Europe's worst affected country, with over 300 cases and more than a dozen deaths. Many public events have also been cancelled in an effort to try to contain the virus. Changes have been made to the Serie and also the Europa League games, with some behind closed doors without fans. A meeting between French President and the Italian Prime Minister was also cancelled. But on Tuesday, health ministers from France, Italy, and Germany, as well as the EU Commission, committed still to keeping borders open. For the latest on COVID-19, joining us in Rome, we have Francesco Sisi, who is an Italian author and also columnist. In Brussels, we have Johan Neitz, who is the president of the International Society for Antiviral Research. He's also a professor of virology at the University of Louvain in Belgium. I hope I pronounced all of these names right. Gentlemen,
absolutely.
Thank you, sir. Gentlemen, let me begin by asking our Italian guest first. Mr. Sisi, thank you so much. During this crisis time, still be able to join us in this discussion. What have been the reactions from the public in where you are, Rome, and other places in Italy about the lockdowns?
I think people are scared, and there is a sense of panic. At the beginning, the government tried to perk up public attention, but the result apparently has been there is too much attention, too much fear now, and recently the government is trying to tune down the awareness, the public awareness. But definitely people are very scared because nobody knows exactly how the infection, the first cluster began, and we have cases all over the places, and we don't have a clear chain of connections, so people are worried. But I would say in recent hours, the number of increases in cases has been slowly declining. We don't know what is the reason. Lots of confusion.
I see. A lot of confusion, and some suggest the panic as a result of the government trying to calm people down. But what is likely to be the latest measures? For example, people try to get themselves protected through face masks. Do you have enough supply of that? There are other details about food supply as well, and also the relations among localities in Italy. Some have been more severely influenced by the COVID-19, others do not yet. So how to see this relationship under this very strained circumstances?
Yes, it is still very confusing, as you said. Some places, some localities in Lombardy region have been under quarantine. However, the enforcement of this quarantine, it seems to vary, as the measures approved and applied by the different localities vary as well. In Veneto, there are some measures. In Lombardy, different measures. In Piedmont, different measures again. We have seen some kind of friction also between local government and central government. Everything seems to happen very fast, and as Italy seems to be pretty unprepared. We have an early warning. Unlike other countries, we realized the situation was very serious and the people reacted fast. But now that things are starting to sink in, the reaction is not really coordinated so far. We hope for the best in the next
in circumstances like this, nobody can be 100% prepared. This is just a 100% fact, I guess, because it's an epidemic and the nature of it is spreading fast. That's why we also want to invite the expertise of Mr. Nates joining us, because you've been doing research about virology, and therefore, what is the latest situation? If I could ask the other expert joining our panel as well, what is the latest situation Europe-wise? What about the EU, for example? Have been any policies out for countries to be able on a united front? Mr. Nates?
Well, I think each country has sort of its own policy, but of course there is a lot of communication within Europe. I must say I'm not a public health expert, but what I hear from colleagues is that there's indeed at European level quite a bit of communication with the top officials. But of course each country also have its own governments and its own decision making, and so this may indeed be different between, let's say, Italy and Germany.
Okay, well, okay, yeah. But you know, to your expertise, because you've been doing research, academic research about virology, so tell me about how strong is the European strength in terms of researching about the virus and also be able to advise public policies based on the degrees of research that you've been having so far?
Yeah, I think we all learn a lot from what we see in China, and of course as researchers it's not just us in Belgium, it's not just us in Europe. I think it's all virologists around the globe that are looking into this, and definitely also in China. So I was in September, I was in Wuhan basically at a international conference on virology, and you have excellent virology labs in Wuhan and in other places in China. So there is a lot of communication, of course, between experts, between virologists about this virus and about how to tackle it. The point is, of course, that in a situation as this one, that we are left basically without any weapons. I mean, the only weapons that we have is putting people in quarantine, putting cities like Wuhan, which is quite an effort and is applaudable, in lockdown, which is also happening in its smallest cities and villages in Italy. So the point is that if you have an outbreak with a new pathogen, as we're seeing now, that it should basically, as human mankind, not just as Europe or as China or as United States or Japan, but as human mankind, we should altogether be better prepared for that. And I have been, together with some other experts, been saying that for years, human mankind is not prepared for this new outbreaks, what I call the expected, because you may expect to happen it, unexpected, because you don't know which virus will basically suddenly appear. And so what you need is, of course, you need technologies to develop vaccines very rapidly, and Europe is funding this, and China is funding this, and you have organizations like the CEPI, the Coalition for Epidemic Preparedness initiative, who are putting money together to do that. And so that's good. I mean, you need platform technologies that allow to rapidly develop a vaccine as soon as you see a new pathogen emerging. But the point is, you will always be a bit too late. And I mean, we could not, the teams in China, put the genetic code on databases on the 12th of January. This was quite an effort. They got that so quickly done. So based on this genetic code, we and others could start working on a vaccine. And but still, as the director of the WHO, Dr. Tedros, said a couple of weeks ago, 10 days ago, something like that, that it may take about 18 months before we have basically a vaccine produced to sufficient quantities to vaccinate a lot of people.
Exactly.
And to help using the vaccine to stop an epidemic. And that's problematic, because we would need such a vaccine now. The point is, you cannot make a vaccine if you don't know your enemy. So you can only start doing that, in this case, on the 12th of January.
Mr. Nates, as you may know, our program earlier, over the past few weeks, have been interviewing some of the biggest names in the field. For example, President of CEPI, as well as President president of European Research Council, which are providing funds for basic research about medical issues inside your continent. But as we know, there is no faster solution when we face an epidemic like this, an outbreak like this. But this does not mean that we could not have future cooperation in order to prevent some of the lack of information and knowledge. Having said that, though, Mr. Nates, now it's about the emergency. What do you think, from an academic perspective, can be done, even about the quarantine, even about how different countries and regions are doing the quarantine, how understanding of the virus would help public policy makers be able to make their decision, and how should those decisions be implemented with the academic aspect bear in mind? Mr. Nates, if you could explain to us about that more, because vaccines is already being developed right now, even though we're still far from it, but now it's a crisis that we're talking about days and weeks that we have to handle it.
Yes, but that's basically part of my understanding of the whole situation. We should have had vaccines, so we don't have them. So indeed, the point is you need basically in any place around the globe to try to implement what China has been doing until now. So China was basically, and this would have been the case in any country, in any region, if something suddenly emerges, you're taken by surprise. And so I think China did right away the right thing. And I think we all have to learn basically from what China did. The question is, of course, if you have to put a big city, take London or Paris, which is about the size of Wuhan. I mean, if you have to put such a city in lockdown, will that be possible in Paris? Will that be possible in Rio de Janeiro? I don't know. I think the situation is evolving, but we should. I mean, social distances are important, as you explained, and Dr. Gallia explained. I think a lot of measures that have been taken are being taken in China. It should be implemented as well in Europe and in other places.
Yes.
I think
but of course, Mr. Sisi, if I could go to you now, a lot of things Dr. Gallia also said has a lot to do with seek truth from facts, which is quite a China principle in a way, because every locality, and in this case, every country, has to look at their own circumstances and check the reality when it comes to the degree, and therefore decide on the measures of the degrees. Mr. Sisi, to Italy now, which is now apparently an epicenter on the European continent, what do you think is the reality? To what degree, as a media worker that you've been talking to around the society, should be the reactions and pragmatic reactions?
Well, the reaction, what should be the pragmatic reaction? This is a very good question. And because, as you know better than me, Italy is different from China. And
Certainly.
It's hard to confine Italians the way Chinese accepted to be quarantined. This is the first reality. Unfortunately, the quarantine, it seems at least that the quarantine for those localities around Lodi, which is the epicenter, the cluster of the disease, didn't work as well as it was hoping. I mean, people were hoping. So we have cases now in Sicily, perhaps one in Rome, and we have to think that cases could multiply in the next few days, the next few weeks. In theory, yes, a measure of quarantine, hard quarantine, should be put in place, but because of Italian society and the way Italians are, this could be very hard to implement. Moreover, we have...
Go ahead, sir.
Yes, sorry,
moreover,
I was too long.
Go ahead.
No, moreover, I think there is a similarity between China and Italy. I mean, the problem is also how to try to contain the virus, but also not to kill the economy. The virus has hit the most productive part of Italy, Lombardy, Veneto, Piedmont. So the economy of Italy could suffer greatly, and if the economic outcome, the economic backlash could be even worse than the disease. So the government is trying to have a balancing act here. it's going to be difficult, I'm afraid.
If I could just follow up about that, I mean, you are now living in Rome because you're sitting in the studio right in Rome talking to us. Tell me, as a citizen there, what access do you have to when it comes to food supply, life supply, and also Medicare possibilities? For example, is hospital being mobilized and specialized in order to set up fever clinics? For example, whether special beds have been putting aside in order to cater to any outbreak if it happens. Hopefully it's not happening. I'm knocking the wood right now as I speak this. But still, Mrs. Xixi, what about that part, the medical side of the preparation?
From what I hear, I mean, I'm no specialist. From what I hear, there has been a preparation there. Hospitals are somehow ready. There's been already an account of how many beds could be available in cases like this. I would say that at least in Rome now there is no panic buying. I mean, both pharmacies and supermarkets are fully fully prepared, full of stuff, and people in Rome walk and live as normally as they were before.
Okay.
The number of cases is not huge compared to the availability of hospitals. So far, the situation is still under control. We have to follow closely, of course, because the outbreak has been very fast, the propagation has been very fast, so we don't know what will be the situation in the next few days.
Before we go, final question. I want to address that to Mr. Nates. From your perspective, whether border control works, because WHO would never prescribe border control or travel ban,
no.
But for Europe, border control should never be the issue. But now, in epidemic, what does it mean to you?
Well, I mean, you have to live in Europe to see how things go, and it's really difficult. I mean, they have all these small little countries. I think it's really difficult to implement border control. I can just take my bike and I can bike to the Netherlands, or I can bike to France from here. I don't know if this is doable. I mean, for a while it may have an impact, it may delay things, but I mean, a virus is spreading, a virus is not looking in where the borders are. It's just happening, and it's going to be difficult. I think I see this spreading. This will be spreading in Europe. This will be spreading other places in the world as well. If I can, so if I just can make further comment, I think a lesson that we should learn from this is that, as I said, I mean, we don't have vaccines, and in the interface, or the time between an outbreak that begins and having a vaccine in, let's say, 18 months, you would need a drug to treat the most sick patients, and also to help to prevent doctors and nurses from becoming infected.
Yes.
And this is something that we need to do for the future, to really be prepared, have, for example, drugs that are active against any coronavirus that we know, but we also know other families of viruses.
No.
And this is something, this is a lesson also from this one. We should make sure that in the future that you can, from the very beginning of an epidemic, imagine that you had, after 150 cases in Wuhan, that you had a drug to treat, that you had a drug on the shelf to treat people with this coronavirus infection. Would never have had today 80,000 cases.
Okay.
You would stop it basically from the beginning, and this is what we need to, a lesson that we need to take from this, I guess.
We would love to talk to you further about this, but of course this is the issue that's already been repeated many times. We'll see how we're going to do this time to see how we are going to be prepared next time. Thank you so much for all the facts and info. Johan, Nates, Francesco, Xixi, thank you so much, gentlemen. All the best to your country and to your people. Thank you.